Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Why do I pee when I cough, and is it normal? If you pee, urinate, when you cough, you may have stress urinary incontinence, SUI, which occurs when the bladder and pelvic floor muscles weaken. Other types of incontinence include urge incontinence, overactive bladder, mixed, stress and urge, overflow, and functional. It's hard to get to the restroom in time. /r/n/r/n. This article covers what causes peeing while coughing, risks, prevention, and treatment. /r/n/r/n/South_Agency, Getty Images/r/n/r/n. When your bladder is full, nerves tell your brain it's time to urinate. Bladder muscles contract, and the urethra, the tube that carries urine out of the body, relaxes, allowing urine to flow. /r/n/r/n. The pelvic floor muscles support your bladder like a hammock. When you cough, these muscles tighten to keep your urethra closed. If you need to pee, they relax to allow your bladder to empty. SUI occurs when these muscles weaken, making it harder to control your bladder when you cough. /r/n/r/n. While this is not an exhaustive list, risk factors for SUI include /r/n/r/n. SUI treatment depends on age, the underlying cause, severity, and preference. /r/n/r/n. Pelvic floor physical therapy is often the first line of treatment. It helps you strengthen your pelvic floor muscles, often through Kegel exercises. Kegels are when you hold and relax the muscles you use to pee. Sometimes, it can be challenging to identify the correct muscles to use, so your therapist may guide you with biofeedback. /r/n/r/n. Here's how to perform Kegels: /r/n/r/n. Take your time when you pee. Don't rush to finish, or you may not empty your bladder fully. If you sit to urinate, sit fully on the toilet seat or crouch in a full squat rather than hovering. Away from home, using toilet seat liners can help you sit comfortably, making it easier to relax your muscles. /r/n/r/n. After you finish peeing, wait a few seconds and try to go again to make sure your bladder is empty. /r/n/r/n. Leaning to the side or forward can help get more pee out. When you feel like you need to cough, tighten your pelvic floor muscles to help prevent leakage. /r/n/r/n. A person with clinical obesity is 4 to 5 times more likely to have SUI because extra weight strains pelvic muscles. Maintaining a healthy weight reduces this strain and lowers the risk of diabetes, which can make SUI worse. /r/n/r/n. Staying active by walking, swimming, and practicing yoga can help maintain a healthy weight and improve pelvic floor function. However, avoiding high-impact sports is best, as they can weaken the pelvic floor. In addition, consider avoiding the following bladder irritants for a few weeks to see if SUI improves. /r/n/r/n. A physical therapist may suggest manual therapy. This hands-on technique uses gentle pressure to release tension and improve muscle function. The therapist may also teach you additional pelvic floor exercises to increase muscle strength. /r/n/r/n. A Kegel exerciser is a soft, medical-grade silicone device that you insert into the vagina. It provides biofeedback through gaming technology and your smartphone, helping you practice the correct form. /r/n/r/n. Additional devices for SUI include /r/n/r/n. While surgery is often a last resort for SUI, it can be very effective at correcting underlying causes. Here are some examples: /r/n/r/n. Botox injections and medicines like ditropan, oxybutynin, treat urge or mixed incontinence, rather than SUI. Your healthcare provider may refer you to a urology specialist to help determine which type of incontinence you have and see if this is an option for you. /r/n/r/n. SUI can be uncomfortable and isolating. Talking to your healthcare provider is important because treatments are available to help you regain control and live actively without leaks. /r/n/r/n. In the meantime, absorbent pads can help. They come in different absorbencies and styles to match your needs. Pads for SUI have leak-proof liners and odor control for extra confidence and discretion. /r/n/r/n. Pelvic floor muscle training, including exercises like Kegels, can help prevent SUI. Consistency is critical, so some people integrate Kegels into their daily routines, like brushing their teeth or lying down at night. If you have SUI already, it may take 3 to 6 weeks to notice the results. /r/n/r/n. Once you know how to engage your pelvic floor and as it gets stronger, tightening these muscles before coughing will be easier and help you prevent leakage. Try combining Kegels with bridges or clamshells for added strength. /r/n/r/n. Peeing when you cough is usually from stress urinary incontinence, SUI, due to weak pelvic floor and bladder muscles. Pelvic floor therapy and Kegel exercises help strengthen pelvic floor muscles, increasing bladder control. /r/n/r/n. Adopting good toileting habits, such as taking time to empty the bladder fully, can also help. When preventive measures are not enough, treatments and devices are available. /r/n/r/n. In more severe cases, surgical options such as a sling or an artificial urinary sphincter may be necessary. With proper treatment, many people regain bladder control and lead active lives. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.